So the article attempts to address psychiatric disability, and the main takeaway is that there seems to be a growing consensus about helpful ways to approach psychiatric patients dealing with disability and maybe some not so helpful approaches. That would be my takeaway.
And my takeaway is that we try to go into a little bit about how to approach those patients. Hi, I'm Greg Kauser. I am an occupational psychiatrist at Mayo Clinic. That is, I work in workplace mental health, and I'm medical director of our employee assistance program in Rochester.
My name is Nick Allen, and I am a psychiatrist here in the Department of Psychiatry. The name of the article, as it appears in Mayo Clinic Proceedings, is Disability Evaluation and Treatment for Patients with Psychiatric Disorders. So the article is going to appear in the August 2020 issue of the Mayo Clinic Proceedings. Where we start in the article is trying to define how big the problem is, and it seems to be a pretty big issue, being that depression was identified by the World Health Organization as the #1 cause of disability in working-aged people. And where we go from there is to cover how the US government defines disability, what programs it's put in place to address it, and then how we approach it clinically. And that's the basic way that the article is structured. Once we cover the clinical steps and considerations, we go into the evidence base as it currently stands for return to work initiatives, or in other words, how to help people with psychiatric disorders to regain function once their problems have become debilitating.
So a number of patients that come in to see us often will come in with issues related to impairment or disability. And we want to start out at the outset thinking that people can do things rather than they cannot do things, and we want to make sure that they're not considered to be categorically disabled. And we want to be as specific as we can about that too. So sometimes people who can't do things in specific environments. So someone who is depressed might be slowed down and have some difficulty concentrating. And that probably wouldn't be good if their job was as a commercial pilot, but they might be able to do something else that's more routine, such as administrative work or whatever that might be. And so what we want to try to do the best we can is explain what those limitations are, because oftentimes employers would be able to accommodate if we're able to suggest what they can do. And often as well, there's help for people around getting them reoriented to work, talking them through about the issues that they have with work. Sometimes it's not the work itself. Sometimes it's issues with coworker or supervisor or whatever that might be. And as clinicians, we can help them through that. And certainly as we're taking a look at this as well, recognizing that none of us has maybe the individual expertise, and we might need a full team of people that includes people like mental health specialists, along with occupational therapy and some other folks that can help with that. And return to work is something that's an iterative process. We don't always necessarily get it on the first shot, and I'm always upfront with people about that when they come in, that we're going to get you there. It might not be on the time frame that you want to, but our goal is to get you back to recovery, and you might not feel like your symptoms are completely resolved until that time. And eventually, that we hope, as your symptoms improve and you get back to work and functioning, that you get your life back.
The purpose in the article was to try to point out what the differences in approaches to disabling psychiatric conditions are, and what are more helpful, what are less helpful approaches, and how might we be able to individualize those approaches to people to optimize their recovery. And maybe that's where the research lies, is for the right patient, how can we individualize this approach to reach that recovery.
I would echo what Dr. Allen said. I guess we do have a lot of resources here. So we have a lot of people that are under the same roof, so to speak, that can come together. But I don't think it matters where you're at. You just have to know your resources and pull together a team that can help with this. 'Cause, again, it's not just an individual provider, but sometimes it takes a group of people to get one person back to full recovery.
We hope that the article brings you some useful clinical tools to help you in your work with patients to bring them a more meaningful recovery. And you can find this article in the latest edition of the Mayo Clinic Proceedings. And thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.